So the average lifespan of a breast implant is about 12 to 15 years. That's not carved in stone though. If your implants are 20 years old and you're still doing fine, just keep on keeping on. But reasons to seek out a re-augmentation would be if your breasts have changed a lot after, say, childbearing or weight changes, and your implants are still what your implants were, but your breasts aren't what they once were. Well, you might want to go larger or smaller with your implants to address those changes that your breasts have undergone. Other reasons would be if you have a deflation or a rupture for any reason. That could be from trauma, it could be from implant age. There's something called a fold flaw. For instance, if you bend an implant or fold it up, create a little crease there. Well, imagine that's in place and it kind of sits there for years, but over years it gets worn. That becomes a weak spot in the implant, and that could be a rupture down the road. So in the past 10 years, what we saw was a lot of women coming in with saline implants who wanted silicone. Because they're a more natural look and feel in general than the salines are, they have less wrinkling and rippling than the salines do, and so women who just didn't like all of those things about their saline implants suddenly had the option to have silicone. So that was the initial wave of increasing silicone use, was the women with salines wanting to switch now that they had access to those improved implants. People tend to think that if they just go with a bigger implant, then they won't need a lift. And that is so not true. Going with a bigger implant just makes you bigger. It does not lift your breast. In fact, it's now a heavier breast that is more likely to stretch and fall even harder, because again, bigger is not better, bigger just falls harder. So if you need a lift, and what that means is if the nipple's positioned low or if most of the breast tissue is below the nipple, you need a lift, not a bigger implant. If you want a bigger implant, that's fine, but it's not going to eliminate the need for a lift. There's no one answer for that. I mean, it's where are you starting from? Where do you want to get to? What does your rib cage look like? What does your current soft tissue look like? What does your skin look like? All of that. And what's your base width? I mean, what's the footprint of the breast itself? I mean, this is a base width right here. So, you know, once we pick the implant based on your width, well, then we talk about how high. I mean, I got a card last week from a happy augmentation patient who just said she feels confident in a bathing suit for the first time in her life. So that's kind of what it's all about. I mean, it's about either giving someone who never had anything a little something, or someone who used to have it and lost it with kids or with a lot of weight change, and restoring that. That's what it's all about, is making someone just feel comfortable in their own skin again.